Dr. Tim, we're talking about facelift for men. So there's certain considerations that we want to look at, particularly in the male population, where we don't want to turn men into more feminine than they necessarily want to be. So there are some considerations. A lot of the times men are also coming in because they've got some familial or genetic predisposition to having just like a bigger neck. So if you look at the gentleman behind me here, that if you look at the shape of the neck here, that is not just fat on the outside or dietary necessarily, because ultimately this particular gentleman has actually lost a significant amount of weight, and his neck just did not decrease significantly as a result. So ultimately the neck exists in layers like an onion. There's skin on the outside, you've got some subcutaneous fat underneath that, you've got some muscles and then some more fat. And I find that it's that deeper layer that tends to kind of come through in different families. So a lot of the times these patients want to come in and their concerns are, my neck looks like mom or dad or grandpa or something like that. And so ultimately lesser means like liposuction and stuff like that is not a great way to do it. If we can catch them early enough, we can actually just do a short scar neck lift, so we don't have to have incisions by the ears. We're able to essentially create contour just like you see over here, and be able to really define that jawline without having to have the risk of incisions. And some people just don't want that additional scar. So in this particular gentleman, not only did he have a lot of fat that actually was underneath that platysma muscle, also had some pretty significant submandibular glands that if we had not addressed some of those other structures and gone through with a deep plane facelift, that ultimately we would not have been able to give him the contour and outcome that he was looking for. And so ultimately, we were able to give this man a brand new neck for Christmas. Awesome.